Treatment plans aren't just for therapists, they're blueprints for growth. Whether you're a clinician, a coach, or someone doing the inner work on their own, these interventions aren't just professional tools, they're personal breakthroughs waiting to happen. And some of them are also what works for me. In this video, we'll walk through a list of meaningful interventions that can help guide healing, structure support, and create momentum, from acceptance to assertiveness, life skills to letting go. Think of them as both goals and guides for yourself or those you support. Here's the list of interventions. Acceptance, accepting limitations or reality. Accountability, anger management skills, such as punching a bag or a pillow. Art therapy, assertiveness training, behavior modification, bibliotherapy, building on strengths, career counseling, coaching, cognitive behavioral therapy, communication skills, community, conflict resolution, couples therapy, crisis planning, defusing or debriefing, discipline, drug or alcohol referrals, empathy, empowerment, encouragement, expression of feelings, fair fighting skills, family therapy, forgiveness, Gestalt therapy, getting a job or a better job, goal planning, gratitude, homework or assignments provided by somebody you trust, increasing coping skills, increasing independence, journaling, letting go, life skills training, active listening, logical consequences of behaviors and observing them, making new friends, dual diagnosis treatment, modeling appropriate behaviors, money management, self-motivation, narrative therapy, parent effectiveness skills or training, partializing, such as breaking down goals into manageable pieces, working on patience, personal hygiene, play therapy, portion control, specifically as it relates to weight or any form of intake, positive self-talk, primal screams, just yell into a pillow or yell underwater, practice exercises, processing, so reflecting and processing things such as guilty feelings, your emotions, what's going on, receiving psychoeducation, recognizing patterns or behaviors within yourself, reframing, relapse prevention, addressing relationship issues, relaxation techniques such as deep breathing, taking responsibility for actions, role playing, self-care skills, addressing sexual identity issues, solution-focused therapy, spiritual exploration, starting over, stop, think, act, strength spotting, strengths focusing or strength listing, stress inoculation, stress management, building and relying on supportive relationships, engaging in talk therapy, therapeutic stories and worksheets, giving yourself a timeout or a break, identifying your triggers and recognizing when they surface, 12-step programs, socialization, increasing socialization, social skills training, social vocational training, values clarification, enhancing verbal communication skills, and workbooks, completing workbooks. Growth doesn't always require a diagnosis. Sometimes it just takes clarity on what sort of interventions you need to implement to overcome any challenges. Sometimes it just takes structure, and sometimes it just takes the right tools. Use these interventions as inspiration for your next session, your next step, or your next season. And remember, you're not starting over, you're starting wiser. Follow for more mental wellness strategies, grounded tools, and human-first support. And remember, when the mind clicks, so does everything else.